Уважаемые участники нашей конференции,
Dear participants of our conference, we are happy to greet you in this hall. Thanks a lot for your activity. As you know, today we are conducting the 12th conference devoted to the public health in the format of city health. Korea and also a few EU countries and our neighboring states, Kazakhstan and Uzbekistan, and in addition to that, this conference we have participants representing different communities and members of the parliament and the Ministry of Health, academia and universities and mass media and involved experts active in the area of control with NCDs. We would like to start with welcome speeches to be followed by the session work during which the experts having a high efficiency high efficient performance in the countries who have obtained a high level of recognition shall be presenting their data. So these are the experts from Central Asian countries and from other countries as well. So I would like you to be active, to ask your questions and to work.
направлены, во-первых, на объединение наших сил, а во-вторых, на те основные моменты, которые нужны для каждой, может быть, отдельной из наших стран, чтобы внедрить эффективную работу по борьбе с неинфекционными заболеваниями. Разрешите, я предоставлю слово депутату Дюргу Кинеша, председателю Комитета социальной политики Раймбачаевой в мире.
Уважаемые участники сегодняшнего мероприятия, дорогие гости,
All of you in Kyrgyzstan. As we all know, the healthcare, this is the basis of the nation's prosperity and survival. It is given the priority within the national policy of the state. And the main principles of the country development strategy till 2026 specifies that the expenses for education and health and the economy should be considered as investments to the future standards of life, as a human investment and environmental development. And in October 2021, the Parliament of the Kyrgyz Republic reviewed the concept of the harm reduction from the sources of NCDs, which defined the main activities in the harm reduction area. And the members of the Parliament of our committee initiated the issues in the agenda aimed at enhancing the public health. Over these 2 days, we shall get an information about the best practices from different countries in the area of NCD control and promotion of health and of reproductive health, and also the state policies to reduce drug and alcohol and tobacco use. And all these best practices should be considered to be integrated into our practice as well. I would like to highlight as well that the event of this high level is a special event, and we would like to express thanks to organizers, to SOLID, to Public Health Network Association from Kazakhstan, and so Aleka, to reduce the risk factors for the human health. And at the end, I would like Association of Social Workers of the Kyrgyz Republic, and I would like to highlight that the agenda of the conference is quite tense and informative. And once again, I would like to greet all of you, to thank organizers for the event, and on my personal behalf, and on behalf of the Committee of the Parliament on Social Policy of the Kyrgyz Republic, to express my appreciation as well. Thank you. Thanks a lot, Venera Kolubekovna, for your warm greetings. Now we would like to pass the floor to the representative of the Ministry of Health of the Kyrgyz Republic, to Ms. Ryskulova. Good day, dear participants and guests of this event. As a representative of the Ministry of Health, I am thankful to your active participation in this event. So, as you know, and as you are well aware of the fact that the world has to overcome the consequences of harmful habits, and Kyrgyzstan is not an exception. COVID is also another big example which compromised the good living conditions and increased the mortality statistics. And for today, the Ministry of Health is undertaking efforts in order to eliminate harmful patterns such as tobacco smoking, drug use, and obesity, and many other risk factors contribute to the big and high statistics of NCDs, including cardiovascular diseases, cancer, obesity, and diabetes. Dear colleagues and partners, I'm thankful, and I would like to express my appreciation on behalf of the Minister of Health and the senior management of the Ministry of Health. We would like to express our thank you words for this joint efforts presented at this platform to fight with harmful habits. And joint discussions and solutions should lead us to good results. And we are thankful to our partners. We should be working to make this world better for us, and you are welcome to Kyrgyzstan. And also I would like to say that the Ministry of Health is implementing national strategies and programs, including the program Healthy Nation Thriving Country. And this is a strategy which outlines all important activities, and this program will be distributed among you for your information. And once again, thank you, and you're welcome. Zulfiya Narbekovna, thanks a lot for your warm greetings. Now we would like to pass the floor to our next guest, the representative of the Ministry of Education.
Самат Багдатович, пожалуйста.
Уважаемые участники,
Dear participants, I'm very happy to greet you on behalf of the Ministry of Education and Science, the Kyrgyz Republic, dear guests from faraway and neighboring countries. From myself, I would like to greet you not only on behalf of the Ministry, but also on my personal behalf. I'm very happy to see you. We hope that you will experience the hospitality of our people and of organizers and of the country as a whole. So harmful habits have been always under the focus of the Ministry of Education and Science, and we believe that the young harmful habits among the young people, such as tobacco smoking, drug and alcohol use, is a negative pattern to be to be controlled through more efficient activities, and particularly the hygiene aspect is important. Talking about the hygiene of the social media, but also we are introducing the new term with the hygiene, ecological raising and upbringing, particularly the spread of the psychoactive substances and synthetic drugs is a critical issue which requires collective efforts of parents and the educational institutions and all the public as a whole. And we are happy to see the agenda of this event containing such important issues for discussion, and I hope it will go fruitful. And as an ex-law enforcement officer and talking to my colleagues who work in the drug control agency, I can hear recent comments about the negative trends, not at the level of the college students, but also the synthetic drugs are getting spread among the younger teenagers. And I'm thankful to the organizers of such a large-scale event, and I wish and hope that this event will produce efficient results and good memories. Thank you. Thanks a lot, Azamat Armadovich. Through the welcoming speeches, we can already see the diversity of the focuses given by different ministries. So the member of the parliament also underlined the issues which are being discussed at the parliament. And now we would like to pass the floor to the Kazakhstan delegation, Densoluk Association, which has been active for 15 years already in public health area in Kazakhstan. And we are passing the floor to Bahit. Good day to everyone. Thank you for the invitation. I believe that the Central Asian countries are very lucky that it is 12th, not 13th, but the 12th conference is taking place in Central Asia. So city areas and suburban areas, they have experienced the wide range of the health issues. And as I've said before, if someone sneezes in Kyrgyzstan and Kazakhstan, in few minutes we say "Sonte." And the pandemic situation has shown to us how fragile we are and how human health is fragile. As a French writer, Gabriel wrote, this is something which people want to save most, but taking least of efforts. And in the past, we had the times when the recommendations of physicians have been fully respected, but then the reform has taken place. And also the SDG has one of the priorities, which is the human health and the well-being of the society. And starting with this millennium, when we made certain conclusions, we could see also the breakthrough dynamics happening brought by the advanced diagnostics technology. New technologies emerging, but organ transplantation, increase life expectancy, but also we have to face new challenges. Life expectancy has increased, but now we're having new diseases emerging and increasing, such as Alzheimer's disease. And this is raising more questions, what to do with autism in children. And in post-COVID epoch, now we will have to come back to these discussions to find some solutions, because health depends just by 8 or 10%. It is dependent on healthcare workers, but it is underestimated. And when chronic patients are asked the question why you have reached such a complicated level, usually they would blame the physicians. And you can see the situation with the environmental pollution.
And the climate makes an impact on the health. Non-communicable diseases, for example, the mortality rate reached 90% of mortality cases because of chronic diseases, NCDs, which could be sustained, and therefore the role of the person is very critical to change their lifestyle, and it is their option to choose the lifestyle they want. And I liked very much, we have the trend to blame the doctors in all our bad things. And I liked the speech of Azamat Bagdatov, the importance of upbringing. We have to foster and ensure proper upbringing of children, and we need to promote this for many generations. And we cherish our senior people, and the senior people have the last resort opinion, and we have to follow their opinion. And now in the past they would say don't eat meat, and now they say continue eating red meat, and the problem is still there. What is our role? What should be changed? And therefore the world is becoming rapidly mobile, and because of the age, highly mobile, I have written this down, mutually connected, mutually related. In a specific single state, we cannot build we cannot, it is not possible to build the healthy population, the healthy communities, the mutual experience, mutual finding mutual solutions, and this kind of conferences are very vital and important. Let us, our future generations, our citizens, to stay healthy of all countries across the globe. Let us stay in good health. Thank you very much. Thank you. Thank you very much to our guests for their welcoming speeches, for their wishes, and now we would like to proceed to the panel discussion, and we will invite the participants of the panel discussion who will participate in the different who will present their speeches and presentations. Whom I forgot? Oh, I'm sorry, I forgot. The most important person I skipped, I missed. Sorry, I bring my apologies.
My name is Kasia Kowalczyk, and I'm from Poland. As a director of the Global Public Health Network, so the organizer of this conference, we are absolutely thrilled to be here in Bishkek in Kyrgyzstan. As you have heard, this is our 12th conference, but it's special because we've never done anything in Central Asia, and I hope it's not the last time that we are present here. And you will be aware, and we've already heard from the panel, that the 70 million population region face a variety of different public health problems, from infectious and non-communicable diseases. And over the 2 following days, not years, that would be far too long, you'll hear experts coming from wide range of different professional backgrounds who will exchange their expertise, who will exchange their knowledge. And you will also have opportunities to meet other people, to create new links. And this is what this conference actually is about, to be able to find other people and to network. И от себя лично я хотела очень поблагодарить госпожу Бакхет Туменову, госпожу Альфию Самгину, потому что без их поддержки эта конференция не состоялась. Так что большое вам спасибо. И уже последняя вещь, я бы хотела, чтобы мы все сейчас посмотрели недлинный ролик про нашу конференцию.
Спасибо большое, спасибо за организацию, за то, что вы поддержали.
Thank you for hosting this conference. Thank you for selecting Kyrgyzstan. Thank you for making such a long way to participate at this conference. Welcome to our country, our sunny and hospitable Kyrgyzstan. You will have long memories and warm memories about these 2 days for a long time. And thank you very much for those who will take part in the panel discussion. And now I would like to invite the participants of the next panel session. Thank you very much.